Good morning to Dr. Azila and my fellow friends. I, Ashwini Kunisegren, together with me, my partner Crystal Emmeline, will be presenting on the common diseases faced by young children. What is cavity? Cavity is tooth decay, and it's the most common chronic disease of kids aged 6 to 11 years old. And also adolescents from 12 to 19 years old also face cavity. Dental cavities are holes in teeth caused by tooth decay, and cavities are common in certain areas of the teeth, such as in between our teeth and also our gum line. In these stages, cavity doesn't show any symptoms or signs, but as time passes, the small black dirt start to create holes in teeth and causes toothache, and sensitive to hot or cold temperatures, pain when chewing, and loss of tooth if the portion of the tooth is break apart. Modes of transmission. Cavity doesn't transmit to anyone, but it transmits from one tooth to another. And consuming a diet high in starch and sugar, not using proper toothpaste at early age, exposed to sugary liquids, powdered milk, and trendy stuffs that contain a lot of sweets. Of treatments for infants, wipe their gums with clean or wet gauze pad, wash mouth after feeding them, start brushing teeth as soon as their first tooth, don't put to sleep with feeding bottle on, no juice or sugary water in feeding bottle and hanging in their mouth. Always clean their teeth before their bed. For adolescents, removing tooth and replacing with a filling. Fillings are materials placed in teeth to repair damage caused by tooth decay. And if for toddlers, encourage the use of cup and ask them to wash their mouth after meal or milk. Place small amount of toothpaste on the toothbrush and teach them to spit out the toothpaste after brushing their teeth. Most common chronic disease faced by young children is hepatitis A. What is hepatitis A? It's an infectious disease of the liver caused by hepatovirus A, HAV. It's an inflammation of the liver globally. Around 1.4 million symptomatic cases are filed every year, and it's a common in regions of the world with poor sanitation, not enough of water, or no safe water. But surprisingly, 90% of children in developed countries are by the age of 10 are facing this problem. No signs or symptoms shown during their young age, but as they grow, nausea, vomiting within 1 to 2 days, yellow skin, yellow eyes, dark colored urine, pain in the abdomen are some of the symptoms that can be seen in young kids. And some children may not show any symptom when infected, but still able to infect to other kids. And some other symptoms are dehydration, feeling weak, unable to concentrate, rapid heartbeat, and urinating less frequently can also be seen in kids infected with hepatitis A. How hepatitis A spread? Well, hepatitis A is spread through exposure to chemicals, poisons, and not sufficiently cooked shellfish, such as lobster and crab, and it also spread through food or water contaminated with infected feces like dirty waters and close contact with an infected person. Yes, hepatitis A can be affected through body contact, and if it's not treated, it leads to liver failure, but it can be identified through blood test. Do we prevent from hepatitis A? Get that hepatitis A vaccine. Wash your hand with soap and keep yourself clean always. And having a properly cooked food as your meal is really important. Consuming clean water is also important. Next, the treatment. There are no specific medicine for hepatitis A, and if someone is exposed to people with HIV, they will be given treatment such as immune serum globulin that prevent one to get infected. And resting at home is one of the treatments that has been suggested for people with hepatitis A. And also avoid consuming medicine that causes harm to your liver, because hepatitis A mostly affect your liver. Lastly, there are no cure for HIV. It's a lifelong disease. And in the last slide, I have attached a YouTube link where you can get more information on hepatitis A, the types of treatments that has been followed, and how to prevent from hepatitis A.
My name is Crystal and I'll be talking about the third disease. So for my third disease, I have chosen measles. So what is measles? Measles is also known as rubella. It is a viral infection that is caused by measles virus. So from here, I'll be breaking down the symptoms from day by day. So measles typically begins with high fever, cough, runny nose, red and watery eyes, which is known as conjunctivitis. So 2 to 3 days once the symptoms have begun, we begin to see Koplik spots. So what is Koplik spots? Koplik spots is white, tiny white spots that appear in the roof of your mouth after 2 to 3 days of the symptoms that has begin. And then 3 to 5 days after the symptoms begin, we begin to see measles rashes. It normally starts from the hairline till the entire face you can see, and then it goes down the neck, and then your trunk, and then your limbs. We start to see flat red spots that appear, and it also they spread to the head and to the rest of the body, so entire body. And when that happens, we tend to have fever that is more than 104 Fahrenheit, which is also known as 40 degrees Celsius. Measles can be spread through the air. So what do I mean by this? If an infected person by measles coughs or sneezes in the air, the virus can stay in the air up to 2 hours. So that's how a child is easily infected by the disease. And this disease is highly risky for kids that have been unvaccinated, and also young children, pregnant ladies, or people's immune system that are extremely weak. So for now, there is no specific treatment for measles, unlike bacterial infections. So bacterial infections and viral infections are two different things. Bacterial infections is infected by bacteria. Viral infections is infected by virus. So viral infections aren't specifically sensitive to antibiotics, therefore it's really hard to treat. The virus and symptoms may typically disappear in about 2 to 3 weeks. Like I said, there's no specific treatment, but there are ways to prevent it and also to lessen their severity. So there are few ways, which is a measles vaccine, which is typically given in 72 hours when you are infected, or there's a dose of immune proteins called immunoglobulin, which is taken in 6 days of exposure. And for kids, they are also known as MMR vaccines, which is mumps and rubella vaccines for children, which is less harsher than the vaccine that we would give to adults. As you can see, I have already linked down the reference. So for my fourth disease, I have chosen scarlet fever. So what is scarlet fever? Scarlet fever is a bacterial illness that is developed in some people that have strep throat. So what is strep throat? Strep throat is an infection that is caused in our throat and tonsils, that is caused by a bacteria called group A Streptococcus. So scarlet fever is also known as scarlatina. So scarlet fever is basically it causes rashes around all over the body, and it also causes high fever or sore throat. And this disease typically is common among children that's between 5 to 15 years old. And although scarlet fever was considered a very dangerous illness back in those days, but right now, like, there are treatments that have been introduced to, like, cause it less threatened. But if this disease was left untreated or unattended, it may cause serious issue to our heart, our lungs, or other parts of the body. So there are 4 signs to indicate scarlet fever. So one of it is red rash. So red rash is not, they normally appear all over the, like I said, all over the body, but it starts from the head, where it begins from the neck and all over the place. So this red rash typically looks like a sunburn, and it feels like sandpaper. If pressure is applied to the reddened skin, it will turn pale. The second sign would be red lines. The fold of skins around the groin, the armpits, the elbows, the knee, which has fold, like, we normally fold this part, they normally appear darker red than the surrounding rashes. Like, apart from here, like if it's here red and this red appears darker than this red. The third one is flushed face, which there's this red ring that appears around your mouth, like, especially children. We can see this very commonly in children. And the fourth one is strawberry tongue. Strawberry tongue is just like the name sounds. The tongue generally looks red and bumpy, like it often is covered with white coating early in the disease. And the mode of transmission. Scarlet fever is passed to fluids from the mouth and the nose. When a person with scarlet fever either coughs or sneezes, the bacteria becomes airbound in droplets of water. So anyone that catches it or inhales the water droplets is typically infected by it. So all of this, especially this thing, it's very common in like when they, like I said, when they touch something or when they cough or sneeze something, like let's say they cough on door handles, and then they, let's say as me, I'm infected from scarlet fever, and I cough on my hand, and then I touch the hair knob, and then a children comes and they touch the hair knob, the doorknob, and they like to rub their face, like rub their eyes and all those things, and that causes the disease. That's how the disease is transmitted towards them. Or if not, this is also typically happens in when we share towel or baths or clothes or toothbrushes or like comb doesn't include it, but like little things that touches. That's how it's infected kids easily, because they like to touch all these things. And next, treatment. Before I go to treatment, I want to clarify on why that touching towel, like you share towels or clothes and all those things, why infected. Because person with that's infected with streptococcal skin, that is the rash and all of those things, it gives out a liquid, and that's what it causes the disease. So that's why doctors normally recommend people to not share their towels or their clothes, all those things. Okay, so now let's go to treatments. So treatment normally involves a 10-day course of oral antibiotics. Usually it's called penicillin. I'm sure all of us have heard of it, and that's when you go to the hyperlink you can see it. The fever will usually go within 12 to 24 hours of taking the first antibiotic medication, and patients normally recover 4 to 5 days after starting the treatment. When a kid that has been infected by scarlet fever needs to be treated with antibiotics, but there are also certain ways to ease the symptoms of the infections, like drink warm tea or broth-based soup to help soothe the throat. try soft food, avoid all this oily and hard food, and stay hydrated with water to moisten the throat and avoid dehydration. And so I'm going to state like few additional things. Okay, like let's say so what I mean by the fever is when you start having fever, the fever spikes up to 102 Fahrenheit, which is also known as 38.3 degrees Celsius. And also children normally feel really cold, really chilly, or they normally have very sore and red throat, sometimes with white or yellow patches that you can be seen. It can be seen with your naked eyes. So children also have difficulty in swallowing or enlarged glands in the neck, which is called lymph nodes, that are tender to touch, and they normally feel nauseous or vomiting, or even they have headaches. So normally the doctors will they just check it by whether you have fever or whether you have rashes, and the tender gland to indicate the symptoms. And yeah, and by this I've also attached the further reference for the scarlet fever, which can be seen if you click down on the link. And yeah, that's it. Thank you, doctor, for your time, for listening to us, and have a good day, doctor.